They played a critical role in helping diagnose COVID-19, but could this be the end of COVID-19 rapid testing? The federal government says it will no longer be shipping rapid tests across the country. This comes as millions of testing kits are set to expire. According to Health Canada, there are 90 million rapid tests in the federal inventory. About 80,000 of those are set to expire within 6 months and 6.5 million within the year.
There is usefulness of the test, but if you don't have public health policy in place, then it limits the usefulness.
Ottawa had ordered more than 811 million rapid tests since the beginning of the pandemic, costing about $5 billion. Experts say the effectiveness of the chemical components in the test degrade over time, making them unusable. And while supply of the test doesn't appear to be the issue, it is demand that has now died down. Dr. Anna Banerjee says it's likely due to the lack of COVID tracking and policies currently in place.
Right now, people can go anywhere, even if they know they have a COVID test. It depends on where you live in Canada, but that's the policy. So and no one's wearing masks anyway.
As I heard the news, I tried to put it into a broader context of where we're going, nationally with COVID. And I didn't do so well at that because I don't know. And I don't know because I'm not sure anyone knows.
Bioethicist Carrie Bowman says while we are in a different stage of the pandemic, there doesn't appear to be a strategy on how Canada should move forward, leaving many questions about how much COVID is spreading.
Oh, I'm an ethicist, so I'm trying to figure out the ethics of this. So what does the responsible Canadian do if he or she feels unwell? My understanding, if you have the symptoms that are possibly COVID related, and remembering that could be fairly broad, the responsible thing to do is to test. Now, look, testing isn't impossible now, but it's certainly going to be a whole lot more difficult than it was before.
Health Canada says a decision to end shipments of rapid tests was made back in January. Now, Dr. Banerjee says that rapid tests are not always accurate. So if you are feeling ill or live with somebody who is vulnerable, it's always best to wear a mask. Nakhavoly, City News.